Thank you. Kentucky lawmakers, they heard testimony about a number of healthcare topics from pain management to drug treatment programs as they line out their agenda for next year's legislative session.
Yeah, former Governor Ernie Fletcher was among the people who testified today. WKYT's Phil Pendleton has more on what was discussed and how it could impact the overall health care of the state. It's our top story at 5:30.
Good morning.
With the budget year looming, once again, Kentucky lawmakers will be presented with numerous requests, and health care always looms large.
When it comes to Medicaid, we've gone from just under $10 billion about 5 or 6 years ago. Now we're over $20 billion. So it's accelerated in terms of the cost.
The Medicaid Oversight and Advisory Committee met for several hours Wednesday, hearing of a number of bill requests.
No other disease has this far-reaching impact.
First up was former Governor and Dr. Ernie Fletcher, who talked about a unique drug addiction treatment program that he calls a recovery ecosystem,
which blends the resources of clinical services, the social recovery model, and community assets of housing, transportation.
Fletcher says it takes about 9 to 12 months to heal the brain.
So his is a little bit innovative. It's something that we need to continue to look at.
Lawmakers were also told of bills to reform pain management to get away from pills and possibly to prevent surgery.
The research shows that shifting to these care options offers immediate savings, not just down the road.
Wednesday's discussion follows months of meetings and ideas to juggle costs versus need.
Have better efficiencies in delivering the services, but we also want to make sure that the health benefits to those folks who are on this are getting the care that they need.
Much of what is happening follows another bill that was passed earlier this year. That's House Bill 695. In Frankfort, Phil Pendleton, WKYT.
The next legislative session where issues like this will be voted on begins January 6th.